Malaysia's general population of pharmacists ratio was approximately 1 to 9,000, which is lower than the ratio observed in high-income countries. Only Pulau Pinang, Wilayah Persekutuan Kuala Lumpur, Putrajaya, Negeri Sembilan and Melaka had a good community pharmacy to population ratio, whilst other states had a ratio of 1 to 8,000 to 18,000. A high density of community pharmacies was seen in urban areas with high population density. A moderate to high number of community pharmacies may be found in the Ipoh district and other states with more suburban and rural areas and lower population density, such as Kedah, Perak, Pahang, Kelantan, and Terengganu, have a moderate to low density population.
This figure shows number of pharmacy per 10,000 population in selected countries 2017 and 2018. According to the Human Resource for Health (HRH) supply, Malaysia aims to attain high income status. The country's HRH stock can be compared into two groups of country based on the country 2017 income based on World Bank 2020. The first group is to select upper middle income country that it has a range of gross national income (GNI) per capita which is similar to Malaysia. According to the data availability from the Global Health Observatory, the nation include that Thailand, Chile, Turkey, Brazil, South Africa, Mexico and Argentina. Second, it is the measure in comparison to high-income countries like Germany, Canada, Japan, Australia, United States, Singapore, and Republic of Korea. Also, a few of these high-income countries are members of the Organization for Economic Cooperation and Development (OECD) group, and all of these data were collected from the official website. This figure demonstrates the progressive rise for the whole profession over a 14 years period. The overall number of pharmacy increased steadily until 2014, when it fell, followed by a modest growth in subsequent years. One probable explanation for the decrease in pharmacy density in 2015 is that the annual certificate (AC) application processes were done manually before June 2014. Due to technical difficulty faced by the Pharmacy Board Malaysia (PBM), AC data for 2015 was not accessible. The 2015 data include pharmacy from both the public and private sector. Moreover, the quantity of pharmacies had already grown by 78% in 10 years. Based on the statistics from Ministry of Health (MOH) from 2009 to 2019, most dental employee and assistant has experienced limited or no change or increase over the last 4 years. Additionally, the percentage growth for dentists in MOH from 2016 to 2018 is extremely significant. However, the number of pharmacy has changed over the time, but there has been no discernible shift in the quantity of pharmacy assistants during the last 4 years.
Thank you, previous presenter. Now, let's talk about the issues related with pharmacies. The first issue is the shortage of pharmacists in certain areas. According to a recent study by Malaysian Health Ministry, despite millions of dollars invest in the healthcare industry, the country is still far from having an optimum 1 to 1,200 ratio of pharmacists in the states. Hospital, clinic, community laboratories, specialized lab, and other companies such as manufacturing and distribution have a high demand for pharmaceutical service. However, the country is investing heavily in increasing the number of pharmacies with a ratio of 1 to 1,000 compared to ID ratio. Besides, in rural area, the issue is considerably more severe. In comparison to bustling cities like Selangor, Kuala Lumpur, and Johor, the ratio of pharmacies to residents in rural area is 1 to 1,600, which significantly lower than the national average. Other states, such as Terengganu and Kelantan, which have more suburban and rural area than a lower population density, also have a moderate to low density distribution of pharmacies with general practice clinic and community pharmacies. This problem can be seen as an issue by having a shortage in certain areas such as suburban and rural area because of the increasing demand from the expanding local population. The higher number of patients to receive medical treatment and medicine supply. Second issue is the supply and requirement gap analysis. This is essentially a comparison of the supply model output to the requirement model output. It can be seen by the difference between supply and demand that is calculated over 15-year period from 2016 to 230 and can be significant different based on supply and demand trend and pattern. Between 2060 and 2030, the population arose from 30,875,400 to 35,965,700 population. Meanwhile, in Malaysia, there will be more than 4.3% pharmacies to meet demand for healthcare, yet the population needs for healthcare will still go unfulfilled. We can see the huge gap between the population in Malaysia with the supply and requirement total gap. The third issue is about new graduates entering the workforce. The country has experienced a tremendous increase in the number of recent graduates joining the labor field, and this has put strain on public sector because there aren't enough people to fill open positions. As a result, there is a lengthy waiting period for fresh graduates to be hired and integrated into the system, resulting in delays of up to 6 months to a year. This becomes an issue about the new graduates because every year and at the given moment, a large number of students successfully finish an accredited basic pharmacy education and are placed on the pharmacy register. Furthermore, the rapid increase of pharmacies in the public sector is attributable to the huge number of graduates joining the labor force and the regulation requiring them to work their first time in the public sector. That's all from me. Next, there will be explanation for the recommendations.
Next are ways to overcome those issues. The first way is to conduct the supply and requirement projection based on population. Assessment of staffing needs is important in achieving a balance of workers in every sector across the country. The Ministry of Health Malaysia can determine the estimated supply of pharmacists as well as the projected requirement for pharmacists based on the needs and demands of the population. It is also imperative to determine the need for pharmacists in accordance with population healthcare demands, which translates into the consumption of healthcare services. Other than that, the government can optimize workforce density without incurring a large cost. As you can see, this is the example of pharmacist requirement projection based on the need and demand. The second step is to analyze the gap between supply and projected requirement. This is one of the steps that can be taken to resolve the issue of shortage of pharmacists in Malaysia. The objective is to find ways to minimize the difference between supply and demand of pharmacists in order to prevent the difference from becoming too wide. Gap analysis can also be used to solve overstaffing and understaffing in the healthcare industry, thereby improving the economic situation and achieving the WHO recommended ratio. And the last way is increasing the number of pharmacists. A method of increasing the number of employees is to use scenarios that are based on demand and supply. A significant increase in the number of universities offering pharmacy degrees or an increase in student enrollment at local universities while maintaining a suitable lecturer-to-student ratio can fulfill future pharmacists' demand and needs. More scholarships and sponsorships can be offered to those aspiring to study pharmacy as a first degree, and awareness of the profession of pharmacists should also be raised. As a result of closing of the gap, pharmacists will no longer be under high work stress, and local college graduates who are interested in healthcare can start working in the field as soon as they complete their studies.
So, to summarize, low density of pharmacies in our country is due to uneven geographical distribution of private and public healthcare facilities in Malaysia. However, the trends are showing an increment for each year, which is a good start to our country. And lastly, we have identified a few issues and also a few alternatives have been proposed to overcome these issues. That's all from us. Thank you.